Since its first description in 1998, onion laser enucleation of the prostate has triggered the interest of the international urological community. It is now recognized as a standard treatment of bladder outlet obstruction subsequent to BPH in most international guidelines. The original technique described by Gilling and Fraundhofer is based on the enucleation of the median and the two lateral lobes. However, this comes at the price of making 3 incisions. As the essence of this technique is enucleation, we started to apply an en bloc HoLEP, fully mimicking the digital enucleation performed during an open prostatectomy. Procedure starts with a transverse incision proximal to the veru. It is extended laterally to the apices, where the enucleation plane is the easiest to find. The enucleation plane is completely developed either to the right as shown here or to the left according to the operator's preference. It is important to respect the dissection plane between the transitional and peripheral zone. We prefer a circumferential sweep, as described here, rather than a push and shove movement, which can result in a capsular breach. The bladder neck is generally reached at the 12 o'clock position. Following this, the contralateral lobe is dissected. This dissection merges with the enucleation plane earlier developed at the apex. From this point, there is always a strip of urethral mucosa which has to be incised as close as possible to the prostate to avoid subsequent damage to the external sphincter. The enucleation of the posterior plane is completed to finally reach the posterior edge of the bladder neck. The adenoma is subsequently freed in one single piece. The enucleation is followed by a thorough hemostasis. Finally, the tissue is morcellated. In the case described here, 50 grams of tissue were enucleated in 14 minutes, which equals to 3.77 grams per minute. The postoperative flow max at 3 months was 29 milliliters per second. The curve is bell-shaped and the post-void residual is minimal. 110 HoLEP procedures have been performed between September 2012 and September 2015 utilizing high-power holmium laser. Of the 110 procedures, the first 55 cases were done using the more classical 3 lobes enucleation technique, and the last 55 were performed according to an en bloc enucleation technique. Hospital stay, enucleation efficiency, and enucleation time are all statistically significantly different between the two techniques. Enucleation efficiency is better with the en bloc technique, 1.97 grams per minute versus 1.19 grams per minute, reducing the operating time by almost 17 minutes, 30.93 minutes versus 47.93 minutes on average. Enucleation tissue weight is similar for both techniques, 59.41 grams for the classical technique versus 59.59 grams for the en bloc technique. Initial results suggest that the en bloc HoLEP is a quicker procedure than the technique initially described by Gilling and Fraundorfer. Further studies will be needed to assess if long-term results are comparable.